Hi Ran, welcome to Health Tech with Purpose.
Hello, Rushi. It's an honor to be here. Thanks for having me.
Great. I just got to learn that you're from Nashville, so I would like to hear a couple of good things about Nashville to start with, and then we jump on to the next topics.
Yeah, well, I'll start with the obvious. It's Music City. I'm a musician myself. What that means is if I would be, say, a 7 or an 8 in another city, I'm a 4 or 5 here. So, you know, that's either good or bad, depending on how you take it. And I just love the neighborhoods, the people here. People rally together in tough times, and it's just a small city with a lot of love going around.
Awesome, awesome. So Ran, would like to know a little bit more about you, and then we'll go to HireMe Healthcare, right? So just want to understand your background and what you're doing these days at the company.
Yeah. Well, for starters, I'm from Charlotte, North Carolina. Grew up there, went to University of North Carolina undergrad, and after that, I actually went on. So I have a little bit of a non-linear career path. I was an attorney. I
Okay.
did criminal and entrepreneurial law.
Oh,
Kind of a
yeah.
strange pair, but it opened my eyes to a lot of things, particularly the startup world. I left domestic practice after about 5 years, moved abroad. I got a master's in human rights in Austria,
Oh,
and I was working on a clean energy slash health initiative, a startup within a startup in Uganda, right up until my daughter was born. I came back for that, and that was the beginning of 2020. So I stayed. Um, but
okay.
from the HireMe Healthcare standpoint,
Mhm.
um, while I was practicing law, a lifelong friend of mine, our dads were actually best friends growing up, so we've been tight since literally day one. Um, he reached out to me. He'd been working at a major healthcare facility, watching these problems with staffing come through, which I can get into detail later if you like. But he wanted some help, and so I came to help him vet an investor who had a guy that I knew kind of 1 degree of separation, if you will.
Yeah.
And I went to that meeting, and somehow I walked out with me and that other guy splitting checks and becoming the two partners on a founders round. And
Awesome.
yeah,
Great. So, how did the idea came to your mind? Like, was there a pain point you were trying to solve? What was the first? I would say the striking point, saying, "Hey, this is what needs to be done."
yeah. Well, the striking point for Trey, who originally drew this on pen and a pad, was watching, working hospital operations
Hmm.
and seeing, these vacancies. We see the aftermath of the staffing crisis, and we attach it to COVID, but it's been this way for longer than any of us in this room have been alive.
Yeah.
And so, he sees these long fill rates, these crucial positions not getting qualified candidates. And why is that? Because there's no qualified candidates? Not at all. It's it was inefficiencies and issues with the system, from algorithmic blocks preventing resumes from ever reaching hiring managers, even though that person was perfectly qualified, would have been a great fit. And so he set out, and that's when he calls me into this and says, you grew up around healthcare, you grew up around startups. We got a healthcare startup on our hands, and this is a major issue we can tackle. Now, we didn't foresee the level of that issue. I mean, the exponential growth in the problem coming just years later, but that was the striking point. That was when the match lit.
Awesome, awesome. So, what's the coming plan? Like, what are the key things that you are planning to build, and probably some of the key challenges you are trying to solve through this going ahead?
Yeah, so HireMe Healthcare is an online job marketplace connecting nurse professionals to job opportunities. Where it's a crowded market, but we focus on permanent placement, which sets
Okay.
us aside from the majority of people in the space. And right now, our one of our primary our principal features is this matchability algorithm called our
Okay.
precision staffing algorithm. It goes a step beyond to pair jobs and humans based on the individuality that each brings to the table. And so our idea, we're focusing on retention, which
Okay.
at the front end starts with finding the right fit. And so that's what our algorithm is set to do. Now, as we move forward, our product roadmap contains ways to make this even more sophisticated. There's AI and machine learning components coming to bring in to truly individualize each one with all the terrifying terabytes of data there is available out there. But as we focus on retention, that's the whole process of once once someone's hired, it just begins. Finding them in a place that they should fit doesn't mean they will. And HireMe Healthcare wants to work with our clients to continue ensuring that relationship is maintained, that trust can be reestablished in the hiring process.
Great.
And yeah, that's how we plan to grow. Got a lot of exciting things on our roadmap, so it's going to be a big year for us.
Awesome. So how does a provider use the system? Because I think for somebody who's trying to look for a job, as you rightly said, they would enter their thing. So how does a provider use the system, and how does somebody who's looking for a job use the system? If you can explain the.
Yeah, so I'll start with the provider.
Yeah.
So for the provider, they use a web app. It operates like a SaaS platform, and they go through and input unique details to each job, not just, here's our job description, read it and see if it applies, but each part of it is a component in our algorithm. So they input all the variables, and then they post the job. And from that point, job seekers can find it, and they can also recruit. And so our matchability algorithm for them then turns and ranks candidates based on hyper-specific details. So they're able to look at who would be a best fit based on this particular job. And from there, they can recruit, set up interviews, move through the process, and then we're not going to tell hospitals how to do their own internal onboarding. No one's going to listen to us.
It's more about finding the right fit to start with.
Absolutely.
Awesome.
Yeah. And then for the job seeker side, it's a mobile app because everyone loves their phones.
Yes.
And so from there, they get to input their profile. It's a one-time application, basically, instead of a unique one for each different job or each different system.
Okay.
They can search by geographic location, and they also get to see what jobs they're a fit for. And then they can one-click apply from there, and they can also be recruited. So you can find a job when you don't even know you're looking.
Okay. Awesome. So, with the system in place, like, what's the impact it is making today, and what do you foresee? Like, how bigger the impact is going to be, both on job seeker side and the provider side?
Yeah, so we're picking up momentum. We're early stage right now, so we're rolling out our product. We spent a lot of time developing it and making sure that it was, ready for the massive task at hand.
Yeah.
So we're gaining traction with pilot programs, particularly amongst small practices. We're getting hundreds of nurses onboarded. Our nurse community is tight-knit. Our director of nurse relations, Denise, does a great job of engaging them in a way where HireMe has a voice. It speaks not just, hey, do you want a job? It's, we engage this community, and we, as a result, get a certain quality of nurses that, it's hard to say they're not jaded with the profession, because 70% of nurses are at this point, more, I would say, as of the last time that statistic was published. But, we find nurses that are looking for something new, that are willing to trust that the process is not entirely broken, that there is hope.
Yeah.
It's interesting, with 30% of the profession considering leaving, 30 plus really, 70% would still recommend that other nurses join. So that's a dichotomy that's a little tough to wrap my head around. But we gain traction by engaging those two sides of the audience. And as far as where I see it going, stratosphere. What we're building is set to reestablish the way that hiring is done. Hiring sucks, but it doesn't have to.
Yeah. So, from a provider's perspective, is there like a certain kind of curation you guys do when a nurse is getting onboarded on the app, or probably when they're trying to create the profiles on the app?
Yeah, so it's able to detect matches on their job list. So if someone signs up with a new profile, and they're now the best fit, when they log into their job, they'll be able to see that. They'll receive a notification. We can set that so that they, are notified, hey, you have a new person that's the right fit.
Nice.
You came to us for the right fit. Here's the right fit. And so there's ways to be notified. Engaging the audience, call it what it is, annoying people with notifications, the way we all get done, the way we receive every day. That's people do it for a reason, and it works.
Nice.
But we want to make sure that people know that we're always working for them in the background.
Yeah, great. So, while building this, what were some of the challenges that you faced?
Oh man, building a platform like this from scratch was tough. We've been through a couple different developers in the process. We built a beta version and there's an interesting story there we don't have time for, but next time.
Yeah.
We tested that, made a few dozen placements, decided that it worked, and then we were moving forward, getting a couple big contracts actually, and then COVID hit.
Yeah.
And priorities in the healthcare space shifted dramatically.
Yep.
Little did they know this would be the lingering effect, one of the biggest issues that comes from it. But when they made that shift, we also made the shift to say, let's just go ahead. We now know that this product works.
Yeah.
People want HireMe Healthcare. They want what it does. And so we decided to go ahead and build it for scale during the pandemic. And, it was a long process, multiple years, a lot of ups and downs, a lot of money, a lot of time. It's hard to budget for those things. I don't even know why they try. But yeah, it was full of bumps the whole way. And we made sure to keep customer feedback as a front and center component of it. So build it, ask about it, and then continue.
Awesome. So seems to be a great journey and journey of an entrepreneur when you're starting, and especially as you rightly mentioned, you cannot predict something like COVID that's going to happen. But then has it acted as a catalyst? Because that's when I think there was this issue of short staff. There was also overall issue of getting the right talent to the right place. So in a way, did COVID become a catalyst for the technology adoption, especially in this space?
Yes, I would say, COVID was a catalyst of so much digital transformation from every day at work, from every meeting now being done. And there are a lot of studies about what that's doing to our brains, but I guess we'll figure that one out. We're the guinea pigs there.
Yeah.
But yeah, in the healthcare space, one of the biggest transformations has been the move to telehealth. And effectively the same way Zoom has taken over work for us, that's what people want to see wherever possible. And it was a massive spike right at the onset. One that was unsustainable. But since then, it's receded, but the baseline is still so high. And there's been talks all over about this. So if people really want to hear that component, they can plenty of footage. But for us, it was a catalyst of our nurse turnover doubled from the high teens to nearly 30% nationwide. The fill rates increased from 80 days to upwards of 90. Every aspect of the problem was made significantly worse, and it feels like it was overnight. When I look back, it was not overnight, but it was a catalyst for a lot of change. And I think people were already on the idea of we want to do everything on our phones anyway.
Yeah.
But this whole idea, some of the biggest bites we've gotten have been from communicating with our nurse community about remote jobs. And that's the spike in feedback and activity on these emails and any sort of communication about that is through the roof. And it's just, people want remote jobs, even in healthcare, even in actual clinical bedside healthcare. And the fact that that's possible is just mesmerizing.
Yeah. Very, very interesting. And as you rightly said, that the remote jobs are increasing. Still, there is shortage of talent and matching of the talent, as you mentioned. So, on the next aspect of it, right? So, how are you planning to scale this? Is it gonna be like geography wise, or are you gonna add, more, I would say, job roles to it instead of nurses? So, what's the plan?
To scale it in every aspect, it's for starters, one of our value props in the beginning is that we're local centric. We're focusing on our market, our home, which is North Carolina and Tennessee.
Okay.
And we're making sure that we get a foothold, start making an impact and a difference there first before we continue to expand.
Mm-hmm.
We're searching for pilots in any major healthcare system. Any anchor tenants out there? Searching for pilots in large healthcare systems wherever we can, but our growth trajectory is regional first. And
Okay.
we think that by, we're talking about getting quality local talent. So if we scatter ourselves, it's harder to say that, but that's the way we plan to scale that. And as far as, verticals, RNs are in a big need. There's a huge need for CNAs, particularly in CNAs and LPNs in long-term care and a lot of the smaller practices. So we're looking at, in theory, our platform works for any non-physician healthcare professionals. Yep. So we could place NPs right now, but we're not targeting that as much. We haven't seen as much demand. I mean, there is demand for NPs. There's demand for everything.
Yeah.
But we haven't seen enough of that need to justify diving too deep into that vertical quite yet. Got to one step at a time.
Yeah. Awesome. So, finally coming to the main theme of the podcast, right? Health tech with purpose. So, I would like to understand what's the main purpose behind it and where do you see it scaling and growing?
So our main purpose is to do our part in salvaging the healthcare system in the U.S. I know that sounds almost cataclysmic, but it's the real truth. Hospitals shutting their doors around the country. I mean, it's on the brink of destruction. No one talks about American healthcare as a beacon of light the way maybe 60 plus years ago they did. And by playing a part in the backbone of that, in our nursing community, taking care of our nurses, trying to reestablish the trust in the system. I don't blame nurses for wanting to leave the profession. I couldn't even get into it to begin with.
Yeah.
And by reestablishing trust in the hiring process and encouraging both sides to focus on the human aspect that comes with all of this, that there's bottom lines, but above all that, there's people, there's human beings in these positions.
Yep.
That's my master's is in human rights, and I always said I would try to find a way to fight that fight. And this is a big step of that in my personal journey. And as a team, it comes down to that trust. Our drive is based on trust, and I think that starts with vulnerability, but that's a whole nother conversation.
Yeah. Awesome. I think it's a very good purpose. Wishing you the best. I hope you guys scale up really fast and grow. S- just waving to everybody who's watching in, and yeah, I hope you guys learned a little bit more about Hire Me Healthcare, and I hope you enjoyed the podcast. Right.
Absolutely. Rishi, thank you for having me. And thanks for anyone who's paying attention to this. Tell your nurse friends we're on their side.